Hi, I'm Dr. Ralph Duckett. I'm a urologist with Caldwell Urology in association with University of North Carolina Hospitals and Caldwell Memorial Hospital. Wanted to talk a little bit today about female incontinence or leakage of urine. There are many women that have this problem, and unfortunately many that may think that there's nothing that can be done about it, or things can be done about it but are not lasting. And so I wanted to dispel some myths and provide you with some information to let you know what might be available, and more importantly here locally. So incontinence can be divided into two general categories. One is what we call urgent incontinence, that sense that, man, I've got to go to the bathroom and I can't get there in time and I wet. The second would be what we call stress incontinence, which is more coughing, sneezing, straining, lifting leakage, and they're very different. For simple terms, think of the urgent incontinence being more of a medical treatment, and the stress incontinence being more of a surgical treatment. The reality is most incontinence bridges both these types, and there are many different options for treatment. Generally, in patients with incontinence, we assess prior surgeries, prior deliveries, current medications, current health illness concerns, in particular diabetes. A classic surgical concern would be prior hysterectomy, but then quantitating leakage, how it occurs, when it occurs, and more importantly, how it's adversely affecting quality of life, whether that be work or simple enjoyable activities as running, walking, tennis, etc. Treatment for incontinence can be as simple as physical therapy, what we call pelvic floor training, and for many women this is very effective. We then have less invasive measures, what we call tibial nerve stimulation. But for most women, especially with the urgent incontinence, we have medical alternatives that can greatly reduce both wetting episodes and the amount of wetting. Surgically, we offer options that are, for the most part, outpatient surgery. And interestingly, most of the surgery is directed towards support of the urethra or P-tube and not the bladder itself. Many women come in saying, well, I've had a bladder attack, or I had a person who had a bladder attack. And the reality is that's a very old term. It's a very, I won't say outdated, but really somewhat outdated procedure. Most of the surgical treatment for leakage or incontinence is centered around the urethra. Most of this surgery involves a little support under the urethra. It's a minimally invasive outpatient surgery that involves two very tiny little groin incisions with no stitches, a very small vaginal incision, and with placement of support under the urethra. Sometimes this does involve mesh, sometimes it does not, but don't let the mesh scare you. Basically, all these treatments are individualized based on the patient, their overall health, surgical or non-surgical capabilities, and more importantly, their desire to have treatment. The first question I ask patients is this bothering you enough you want to consider treatment options, whether that be medical or surgical, or in some situations combinations. The thing that I want to get across is, one, if you're having leakage or incontinence, there are things that can be done. Number two, they can be very simple. They're not always surgical. Get over the history of the old bladder attack that doesn't really occur anymore, and the treatment options, if surgical, are very durable. So if you have questions or concerns, please feel free to contact us. We'll obviously talk in more detail, assess your situation, and hopefully find a solution that makes you happy and with a great quality of life. Thank you.